Welcome back to our podcast. Today, we are diving into a fascinating collection of research published in Global Health Promotion, Volume 32, Issue 1 Supplement, December 2025. This special issue brings together 7 interconnected studies that explore how schools can become powerful platforms for health promotion and cancer prevention. Let's explore what these researchers discovered. Setting the stage why schools matter for cancer prevention. Before we jump into the individual studies, let's understand the big picture. The editorial by Ifra and colleagues frame this entire conversation beautifully. They make a compelling argument. Early childhood is a strategic period for cancer prevention. The habits children form around diet, physical activity, and sun exposure during these formative years determine their long-term cancer risk. But here's the paradigm shift they are calling for. We need to move away from moralistic approaches that simply tell children what to do. Instead, we should focus on capacity building, empowering young people with the psychosocial skills to make healthy choices. The health promoting school approach isn't just about individual behavior. It's a tool for social justice. By changing school environments and policies, we can reduce the inequalities that lead to higher cancer rates in disadvantaged populations. Study 1. Can peer-led programs travel? Our first study tackles an important question. If a health intervention works in one region, will it work somewhere else? They studied the P2P program, a peer-to-peer smoking prevention initiative originally successful in the Occitanie region of France. Smoking rates are particularly high among vocational high school students, many from working class backgrounds. The program is grounded in the theory of planned behavior, which says that behavior depends on perceived control, intention, and subjective norms. The researchers tested whether P2P could be transferred to 2 new regions with different socio-demographic profiles. They used the Reach Effectiveness Adoption Implementation Maintenance Framework, REAM framework, to evaluate not just effectiveness, but how the program was adopted and maintained. The results were encouraging. While smoking rates varied by region at baseline, the intervention prevented the increase of daily smoking across all regions. There was no significant difference in effectiveness between the original and new sites. The program successfully transferred. But they also identified critical factors for success. Peer educators, the students themselves, need recognition like diplomas or certificates to stay motivated. And organizational constraints, particularly exam timetables and school holidays, were the primary barriers. The takeaway: peer-led interventions can work in different geographical contexts, but they need support from local prevention structures and flexible implementation guides. Study 2. Building an alliance between schools and cities. The second study describes an ambitious research protocol called Alliance for Health. This isn't just a school program. It's a complex intervention designed to create a continuum of health promotion between schools and their municipalities. The study involves 101 schools and approximately 10,000 pupils. It uses a multi-site cluster randomized trial with a realist evaluation method. Rather than just measuring outcomes, realist evaluation focuses on understanding how and why interventions work in specific contexts. The program operates on 3 levels. First, they train teachers to co-construct health actions. Second, they help schools integrate health into their policies and physical environments. Third, they train municipal staff and elected officials to create health-promoting environments beyond school walls. Over several years, they are tracking indicators like school climate, screen use, sleep, and psychosocial competencies. They are also using a social positioning index to account for socioeconomic disparities, recognizing that not all schools start from the same place. Study 3. The Path Forward for School Health Research. As we approach the 40th anniversary of the Ottawa Charter, Foucault and colleagues offer a critical perspective on where school health promotion research needs to go. Here's a startling fact. 40% of cancers are preventable through lifestyle changes. That makes schools absolutely critical venues for early prevention. But the authors have a critique. Too much current research focuses on isolated initiatives aimed at short-term behavioral change. These are less effective than whole school approaches that integrate curriculum, school climate, and local partnerships. They identify three key challenges. First, there is a no-do gap. We have scientific knowledge, but we lack the implementation science to apply it effectively in real-world school settings. Second, social inequalities are being masked. Research often presents results as averages, hiding whether interventions help or harm the most disadvantaged students. The authors advocate for proportionate universalism, interventions that are universal but with intensity adjusted based on need. Third, there's an issue of epistemic justice. We need to value practical knowledge from teachers and field workers alongside academic knowledge. Otherwise, interventions won't actually be adopted. Study 4. The Food Literacy Gap. Moving to nutrition, her and colleagues examined food literacy in children aged 8 to 11 across 31 schools in France. Food literacy encompasses the knowledge, skills, and attitudes needed to choose and prepare food. The findings revealed some concerning patterns. While children knew kitchen utensils well, many struggled with practical skills like modifying a recipe. Only 37% reported eating fruit daily. There was a significant gender gap. Girls scored 0.72 points higher than boys on average. But the most striking finding was a social gradient. Children in schools with a lower social position index had significantly lower food literacy. There was a 2.17 point gap between the highest and lowest social quintiles. This reinforces a crucial point. Interventions cannot be one size fits all. They must be intensified in socially disadvantaged areas to prevent widening health inequities. Study 5. Making physical activity last. In Quebec, Laberge and Gosselin studied what happened after an innovative program ended. The Active at School initiative provided 3 years of digressive funding to help schools implement 60 minutes of daily physical activity. But what happens when the money runs out? The program had an interesting design. A top-down goal of 60 minutes, but bottom-up implementation where schools chose their own activities. This flexibility fostered ownership. The researchers identified 8 sustainability strategies, with 3 standing out. First, 72.3% of schools institutionalized the program by modifying their official educational project, making physical activity a permanent priority regardless of staff turnover. Second, many schools involved older students as leaders for younger ones, creating peer-to-peer engagement. Third, community collaboration was key. Partnering with municipalities for access to facilities like gyms and fields became a critical survival strategy after funding ended. The lesson? Sustainability requires more than enthusiasm. It requires institutional commitment and community partnerships. Study 6. Baseline data on psychosocial skills. Our final study by Salk and colleagues provides baseline data for a program targeting 4th graders in schools with marked social inequalities. They measured 4 psychological constructs: life skills, self-efficacy, life satisfaction, and health literacy. The results showed pupils scored lowest in life skills with a mean of 60.5 out of 100 compared to life satisfaction at 74.8 or self-efficacy at 70.9. This suggests life skills are relatively new or under-addressed in the French curriculum. Gender differences emerged again. Girls scored significantly higher than boys in life skills, health literacy, and life satisfaction. Interestingly, there was no gender difference in self-efficacy. The study also found significant regional disparities. Scores varied considerably between some geographical districts, indicating that local cultural and educational contexts strongly influence these metrics. Conclusion: what this all means. Let me bring this together by returning to the conclusion article by Foucault and colleagues, titled Challenges and Prospects for Research into Health Promotion in Schools and the Fight Against Cancers. These 7 studies paint a clearer picture. Schools are essential venues for cancer prevention and health promotion. But success requires moving beyond simple, isolated interventions. The research shows that whole school approaches work, especially when they bridge schools with their communities. Programs can transfer across regions if implemented thoughtfully. Sustainability requires institutional commitment, not just temporary enthusiasm. But perhaps, most importantly, these studies reveal persistent inequalities. Whether it's food literacy, psychosocial skills, or program outcomes, disadvantaged students often start behind and risk falling further behind without targeted support. The path forward requires implementation science that bridges the no-do gap, proportionate universalism that addresses inequalities, and epistemic humility that values the practical knowledge of educators alongside academic research. That's our look at this important supplement from Global Health Promotion. Thanks for listening, and we will see you next time.